Okay. All right. So I want to say welcome to our first ever consumer town hall. This meeting and subsequent meetings to come has been produced and guided by the Consumer Advisory Group. And we're going to speak to what the Consumer Advisory Group does in just a couple of minutes. While you're going to hear me doing a lot of the yakking today, it really is, it's a group effort from the group who are really sharing with us what they think is important for us to bring forward. So just some consumers are joining by video and some consumers are joining by phone. If you have a question, what I'm going to suggest is that you can either, if you go down, if you're on the computer, you'll see if on the smiley face, there's a way to raise your hand. And if you raise your hand, we'll know you have a question. If you're on the computer, you could also type a question into the chat. And if you're on the phone and you have a question, what we'll do is I'll pause through each section that we go through and allow time for questions. So if you have a question, hold on to it. Don't let it go. Just hold on to it. And we will have a pause where we can get your feedback. It's just as opposed to everyone having questions. We didn't know how many people would join. So this will be the best way, I think, for us to keep things moving along. I am recording the meeting and I can make this recording available after. So we do hope to make this a regular meeting, occurring meeting. And so certainly we'll be looking for people's feedback and questions moving forward on what's the most useful way for us to frame this meeting. So I'm going to ask Penny right now to speak briefly about the Consumer Advisory Group.
Okay, hello everybody. I'm Penny.
Hi, Penny.
I'm one of the co-chairs of the Consumer Advisory Group. We meet monthly, and currently it's video, but used to be face-to-face, which I would prefer, but COVID. We provide advice and a consumer voice to also senior management and the board of directors. So we if you have concerns, then we bring them to the board. For example, we were able to see the early drawings for the new building that they're putting up for the main office. We were able to share about private meeting, about the meeting spaces, the parking, accessibilities. We're going to go in a few weeks. Actually, we'll be touring the new site and share our perspective on accessibility finishes and before it's completely done so that they can make any arrangements or necessary differences, You gotta forgive me, my first time speaking, so I'm new at this.
Great, Penny. Okay.
We also helped set this town hall meeting up and gave advice on, some of the things that we wanted to talk about with it. So, okay, that's about it.
Okay. All right, great. Thank you, Penny.
You're welcome.
And what I'd like to do now is we have a special guest that we have with us here today. And Shauna Carter is a nurse practitioner for complex continuing care at Hotel Dieu Grace Healthcare, in addition to her role as a nurse practitioner for Schlegel Villages. She's an alumni from the University of Windsor, where she obtained her nurse practitioner certificate and her registered nurse certification. Shauna is a member of the governance board, Essex County Nurse Practitioner-led clinic. In addition, she's a member of our board of directors. And Shauna has agreed to come on today to talk with us a little bit about COVID vaccinations and answer some questions. Thank you, Shauna.
Sure. Thank you guys for having me. So on my screen, I can't see everybody, so obviously I can't see all the visuals, so if you have a question, just please do interject. I just want to say I should add to my bio that, also is near and dear to my heart because I used to work for APPD, both in the in-home program and Longfellow when I was going through my nursing program. time. So I do remember when Lynn asked about me coming onto the board, it felt really nice to come back, and there's still some familiar faces. So thank you again for having me. I will be forthcoming that I'm not an immunologist, you know, I'm not a physician that specializes in infectious diseases, but I will certainly do my best to answer any of your questions. And if I can't, I will make sure I get the information for you and bring it back if able.
Okay.
Did you want me to go over the questions that you had?
I think so, Shauna.
Okay.
So I did forward, I had received some questions in advance from from consumers that I forwarded to Shauna. Yeah, if you could, Shauna.
Okay, so I believe that one of the questions was, are there any interactions with medications or over-the-counter herbal remedies that we should be worried about in preparation for the COVID administration? To date, and I did have some conversation with one of my physician colleagues, we are not made aware of any medications or herbal remedies that would have any contraindications with the COVID vaccine. So meaning, if you're on medications for certain disease management, that should not interfere. You know, with respect to herbal over-the-counter, those things would be very hard to study because there's so many different herbal medications out there. But in the studies that they have conducted, we don't see any interactions. And in the populations that I've seen who have been vaccinated, haven't had any problems with many of the medications that they are on.
Okay.
I believe one of the other questions was, if I've had COVID, how long do I have to wait before I can become vaccinated? You know, there's certainly a lot of different information on the internet and in the news. But essentially, as long as you're symptom-free, and if you had to be in a quarantine because you had COVID, we want to make sure that your quarantine is finished before you come out to get vaccinated. And as long as you're symptom-free, there is no defined waiting period. You don't have to wait a month or 30 days. You know, unless you and your medical provider have had conversations, or if your medical provider feels that you should wait a little bit longer because they have a better handle on your, you know, medical history, there is no need to wait as long as you're asymptomatic and your quarantine has been cleared.
Okay.
There was another question around how long between the two doses. This one's a little bit more tricky. So right now we do know in Windsor Essex that the vaccines being provided are the Moderna, the Pfizer, and the AstraZeneca. Now they all have different timelines between first and second dose. Pfizer is usually a 3-week mark, but because of shortages and whatnot, they've even had to extend that time frame for up to 4 months for some people. Moderna was a 4-week in between, and with the AstraZeneca, 4 to 12 weeks was a recommendation between both doses. What we're hearing is, again, you know, these vaccines are new. The technology is not new, but the vaccines for COVID specifically are newer. So of course they haven't been around long enough to study, you know, what the effects are with the immunity if there's a longer period of time that's lapsed. But we're finding that if you are being asked to wait 4 weeks to 4 months, there hasn't been any great concern that's been expressed. You get some pretty good immune response, specifically with the Pfizer and the Moderna right after your first dose, but even the AstraZeneca, once you've had the second dose, you're getting some good protection. So my recommendation would be is when you're getting your vaccine, they will tell you when your next dose is due, and some of that changes from time to time due to availability. I myself personally, mine had to be changed due to availability, but they're not expressing any great concern with the waiting time in between the way it's been set up so far. And depending on what vaccine you get, they will definitely advise you as to when your next appointment is going to be. So I hope that helps with that regard. And I'm just, because I'm on my phone, so I don't have a camera on my computer, I'm trying to remember now.
Well, I mean, maybe we can speak even. So before everyone got on, Janet had a question about, could you, if you get the vaccine, can you still get COVID?
Yes, that's a really good question. So the biggest take-home message, and as Janet and I were talking, is that you could still get COVID, but when they did the studies, they were looking at the severity of COVID, and they're finding 92% and upwards, especially with the Moderna and the Pfizer, protection against the very severe forms of COVID that would land you into the hospital. And when they talk about severe, they're talking about the COVID that leads to respiratory distress, needing a ventilator, going into sepsis or systemic shock, and the things that would render you needing a hospital, maybe even ICU. So that is where all the vaccines are very effective in preventing that. There are some suggestions you could still get COVID, but you won't be getting the severe form that would put you in the hospital and compromise your health, which is why it's so important to get immunized with COVID, for COVID, sorry. And I'm trying to remember what the fourth question is, because I know there was a fourth question on your list. I can look it up while I'm on the video here. Okay. Is there any other questions that anyone else has so far?
I'm curious about, you hear in the news, and Janet and I talked about it earlier today, about the third wave, and, that how this is, like, what is your opinion or your sense on that, Shauna? Is a third wave imminent? Is it coming to this area? What's your sense?
Well, I think we know there have been new variants, and they have made their way to Ontario. So we know the cases haven't completely decreased. So we're being mindful and realistic that a third wave can happen. It's hard to appreciate how severe it will be, because we are starting with vaccinations, so we're hoping that will help with the severity. But we tend to take extra precaution and treat it, even though some of us are immunized, we're still wearing our masks and our appropriate PPE, because there's a lot of people still not immunized. The suggestion is that we should be decreasing viral shedding theoretically once we're immunized. But with these new variants, that's the one thing. This studies initially were done on certain variants of the COVID virus, and some of the newer variants like the UK and South Asia, initial studies are showing that there is some protection with some of the vaccines that are out. But if more or newer variants come and they haven't been able to tweak the vaccines yet, we have to be very mindful. And that's why I think with this virus, it's a day-to-day. Anything's possible. I think it's very possible a third wave could come because we have these new variants that are complicating things. I like you, I'm feeling a little more optimistic, but I'm still very cautious. It's okay to have hope. It's okay to hope that, in a few months we'll have a new normal. I don't think we're going to see a completely normal for a very long time.
Right.
But I think if we all do our part, still exercise safety, social distancing, our proper masking, doing our part to get immunized. If you're able to get a vaccine, any of the 3 vaccines are really good.
Yeah. Okay. So you're recommending, even that, the AstraZeneca has been in the news, right, with some controversy with the Oxford based batch, which I understand is not what we have here. So for your patients, are you still, if they're able to get the AstraZeneca, would that be your recommendation that they do that?
Yes. And there was a new study, and it apparently just came out a few days ago in the US. They're starting to even look at, it is okay to give in people older than 65. I know initially they hadn't done a lot of studies on that. In all honesty, if you read different things, yes, there's suggestion it may not cover all these new variants, but it is still a very good vaccine. And when you're looking at the risk of acquiring COVID, I think the benefit of getting the vaccine far outweighs any risk of getting COVID and potentially being hospitalized with COVID. And it is still a very good vaccine. So really, I think if a vaccine is available, I would strongly encourage pursuing vaccination with the vaccine that's available to you.
Okay. Janine has a comment in here. Is the health unit giving more vaccines to the Lynn clients?
So what I understand, go ahead.
No, you go ahead. It's okay.
I was just going to say, with regarding the acquisition of the different vaccines, as I understand, talking with physician partners, there was an ethical framework that was kind of guiding us on whom to start giving the vaccines to first, and essentially they were starting with different age groups, long-term care and retirement home, of course. So, if you're a client of the Lynn, or even just with your own healthcare provider, if they feel that you're other health conditions or comorbidities is sometimes the word we use, would put you at greater risk to get severe COVID, they can advocate with your primary care provider to get the vaccine. And people have been vaccinated who are under that age group. So for example,
I did.
out to 80 and over, some people have been advocating and able to get the vaccine at a younger age sooner. So that's a conversation to have with your primary provider.
Okay. Okay. So
Does that kind of answer that question?
I think so. So what I'm aware of as well is that, yes, so as part of that ethical framework, so people with chronic home health care, so through the LIN, have been contacted by the LIN and been able to get vaccines. And Penny's volunteering her information. I wouldn't have volunteered that, Penny, but you did.
Sorry.
No, that's okay.
No, I appreciate that, Penny. And that's good that the LIN is being proactive
They
and reaching out
contacted me and asked me if I wanted it. So
I think that's great. Because they are asking. Now I'm in a hospital setting, so it's a little bit different. I do a little bit of primary care on the side, but they're asking primary care providers to kind of rank their patients in terms of their health concerns, so that people who are already very compromised are, going to be maybe prioritized on the list, because we do realize if certain health conditions can compromise you, or you're more predisposed to being compromised more severely if you get COVID.
I kind of thought it was for the nurses as well, because I do have a lot of nurses coming in, and it's making them safer too if I'm vaccinated, right? I mean, it's going to help the nurses as well.
Well, sure. The more they're vaccinated, it should hopefully help with decrease the viral shedding for sure.
Yeah.
But I'm glad to hear that they're ranking and prioritizing patients when they identify they have certain health care problems. I think that's really good.
Yeah.
As for how much vaccine the public health gets, it's kind of on a day-to-day too. As we acquire more of our vaccines, that's sometimes why the dose times have been changed, because it's a supply and demand thing.
Yeah. So we've been advised by that, I think it's the health unit or Rinder Regional Hospital, or both in conjunction, that those vaccine availability for our consumers and their essential caregivers is imminently available. So on our end, we've been making all those calls to consumers, collecting names for those who haven't got it, getting their consent, and then we submit that to the health unit. So that's happening this week. We don't know when those appointments will be set up. We're the collectors of the information and putting that forward, but it feels good to know that at least our consumers are in queue, and that's going to be imminent. So
no, absolutely. And we started something similar at the hospital. For now, with full disclosure, it's been by the age group and the ethical framework, but we're certainly advocating to, a lot of patients in hospital do already have some degree of compromised state, right? So,
right.
Yeah, but the goal is they are looking to get all Canadians vaccinated. It's going to take time, but it is the goal.
Right. Okay. All right. Does anybody else have any other questions? I should mention Sarah's on the line here. She can hear.
Sorry about that. I didn't know that WebEx was something that you had to download, so I thought it was a built-in feature with Outlook, that's why I've been late. I was trying to download it, and it's been giving me technical issues, so I had to phone in late. So sorry about that.
That's okay, Sarah. We're glad you're on. So
I've had that problem in the past before.
That was me like last March. Every what can you hear me? I can't see you. So Sarah, I understand.
Yeah.
Does anybody else have any questions for Shauna? Nola's typing. Can you see Nola's chat?
I'm just going to open it back again. Okay. I just lost the chat for a sec. Hold on. Okay, so I'm just going to read it out. So would type 1 diabetes classify as a greater risk? Where should I get my doctor push for me to get my vaccine faster? So certainly diabetes type 1 or 2, it is what we would consider a chronic disease. And I would say that diabetes, yes, would put someone at a little bit increased risk. And I do know in attending other conferences, people with diabetes, there was some suggestion that they might be more apt to getting it more severe if they were to contact. Now, having the conversation with your primary provider or through the LIN, because as Tracy, you're saying, you were able to help compile this list. Just to ask, say, you know, is this something we should look to see if I should get it sooner than when my age group comes? I would have that conversation with your primary care provider. I don't know if I'm allowed to ask Tracy, with also creating the list, is that a service also is able to provide for all the clients outside of their primary care provider? Is that something they can help?
Yes, it is. So all of anyone who's in receipt of our services is now becoming eligible for the vaccine.
Okay.
So we're compiling that. They ask us to do the preliminary, right? Reaching out, kind of compiling the names, getting the health card numbers, getting that organized. And then we submit that to the health unit, who then in turn will set up the appointments. So, so it's imminent. These appointments will start. I don't know when, but I would assume it would be over certainly over the coming weeks, the next week or two.
So Nola, you could always follow up with your provider if you don't hear anything within a week or two, just to see on their end. But it sounds like they have a pretty good plan, and they've kind of already started to rank some of the patients through also with the public health unit. So it's encouraging if you're saying they're hoping in 1 or 2 weeks to start. That's great.
As we're making those calls too, so the person in the office next to me is making some of those calls, so I can I hear a bit, and I know that what's happening is many people, several people I would say, are saying, my doctor's office has already called me. So that's promising. So I know that on the other end, these calls are happening, that, these options for vaccines are coming, not just from us. They're starting to come from a bunch of different ways. Yeah, it's good. It's really good. Or people saying, oh, I've already, I'm in my 60s. I've already got it done. So people they're already have it. They're ahead of the game. So.
Yes. And I remember the fourth question was just around protection after the first dose. Without getting too much caught up in all the specific numbers, is yes, you know what, you do have good protection. They did studies at about 7 days after the first dose and at 14 days after, and even by 14 days after the first dose, the rate of effectiveness, we're already at 90% from some of the first doses of the vaccine. And certainly part of the reason the second dose is given is also to help boost the immune system. So you do get some protection. They do say you need to wait though about a week or two, which is why we're seeing the rates at 2 weeks, you're getting good protection. So I think that was part of the other question is, how long do I need to wait after I've had my vaccines to be at less risk of contracting the severe COVID? And the answer is 2 weeks after your second dose for optimal coverage. But you do already have some initial protection 14 days after your first dose. Even 7 days, there's a little bit, but if you want to be really safe and know that you have the best benefit of the vaccine, you really want to look at the 2 week mark after your second dose, whatever vaccine you're receiving. And we don't have the Johnson & Johnson. I know it's a one-shot vaccine, but we don't yet have that here. So that's why I didn't just get into discussion, because until we get it, and I can't really speak to it because we're not administering it yet locally. So.
And getting the vaccine doesn't mean you can stop wearing your mask.
Correct.
Just to be clear.
Yeah. Because again, the big thing we do have to still be mindful is they're always studying, they're always going to be studying, and as there's new variants coming, they're going to restudy and see how are these helpful. There's suggestion that some of the vaccines are better than others with certain variants, but we can't control the variants coming in. So that's why we still have to be mindful. We still have to act like a third wave can come. I would say hope for the best, kind of prepare for the worst, be very mindful. We don't want to ease up too quickly and put too much, we don't put all our faith in this vaccine and assume all is okay. Well, we know the virus is going to be around for years to come, but if we get vaccinated, do our PP, the hope is that we're not going to see the severity. That's the key with COVID, is avoiding the severe complications leading in hospitalization and death.
How much longer is this going on?
The biggest concern. Sorry?
Hi, who is that?
How much longer is she going to talk?
Shauna's gonna be done in about, within the next 5 minutes.
Sorry, I have a question.
Sure.
Yeah.
Thank you all for this. I registered my mother as over 80 because my healthcare provider asked me to. But she's also a caregiver for my brother who's disabled with brain injury. So they called the healthcare unit to ask if where she stands at in terms of vaccination, and they said they take them as random for the elderly. So I'm not sure what to do now. Like, should you just wait for her to be picked randomly, or should we fast forward the process to get her vaccinated as a caregiver?
So that would
Don't
be
worry, I had to wait. I tried that, someone just to wait.
You had to wait as well, okay.
that would be more of a question for the health unit, and again, depending on the supply they have. The only other option is you can look at if AstraZeneca is available elsewhere, you know, depending on your preference in that.
These are questions it's hard for us to answer, right, Shauna? Like what comes, you know, are you better going as a caregiver? I think it's still random. It's so hard to know what would be quicker, Janine, to get your mom the vaccine. Hopefully that comes soon.
Yeah. And as we get
Many
more
people
supply,
didn't,
it'll
they
open up
wouldn't
more.
give it to them.
Pardon
They
me?
wouldn't give?
No. People that went with their partner, they didn't get shots. They had a little thing in the TV about it.
Okay, so they would only do the person that was signed up with an appointment and.
You're the one that has the appointment.
Yeah.
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 You
It is
gotta
by
be
appointment.
selected. Might never get selected, but you gotta be selected. I have been registered from day one. Haven't heard a thing.
Okay.
And, you know, it's hard. Just be patient. Know that they are looking to get all Canadians vaccinated. It is their goal. It's hard. They have to go through an ethical framework, but then they also have the supply. I know a lot of us are ready to volunteer, but because they don't have the supplies yet, we've been told they're even going to let us know as soon as they get more in. They're going to pull some of us to help volunteer to vaccinate too. So hang in there. It's easier said than done, but it'll come.
Sarah, you had a question?
Yeah. Now, what is the reason between, because first they were saying, you know, the reason between the time change between vaccines, because now it's 16 weeks between your first dose and your second.
So, I realized you had to download. So what I was explaining earlier is of the 3 vaccines we're using, all 3 of them have different time frames, recommendations between the 2 doses. But very honestly, some of the reason for the change is, again, the supply. I explained, even myself, I was affected earlier on that my second dose was delayed because of supply. What we're finding is that in the preliminary studies that there hasn't been any great concern if it's been extended a little bit longer. And in many of the vaccines, the second dose is in fact acting as a booster. We can't say long-term if there's any concerns with decreased immunity if it's past 4 months, because they just haven't had the time to do those studies. But overall, a lot of the time changes has just been, again, around the supply. But a lot of the monographs have said you can go a little bit longer in between the different doses, but each vaccine itself also has different recommendations. So AstraZeneca can go 4 to 12 weeks between doses. Pfizer was recommending initially 3 weeks, but they have delayed it, and they're not having any concerns with that right now. And the Moderna is typically at a 4-week spacing between first and second. So a lot of it is around supply as to why there's been changes.
Okay, so it's more about supply then. Okay.
I have one last question. Sorry about this.
It's okay.
The flu shot's once a year. So what is the COVID shot going to be once a year?
That's a very good question. So right now, this is where they're still actively studying to get it. This is one thing we really don't know yet. is the longevity. However, I spoke with my physician colleague, and she had attended a conference with an excellent virologist, someone studying the viruses, and they're hopeful with some of the newer technology in these vaccines that we might have longer lasting effects. Now, I can't say that 100% right now because, again, they have to finish doing the studies. So we don't know yet what the frequency will be, but there is hope that it will provide longer lasting immunity than some of the typical flu vaccines. But it is going to be a time will tell, and we'll have to watch how the studies unfold.
That's true. It's the first year, right? The second year. So we really don't know anything.
Yeah, but she was very hopeful after hearing the virologist speak that with the newer technologies, it's not brand new technology, it's just newer compared to some of the other vaccines. And they're hoping for really strong immune responses or seeing some good results.
You realize all of us are going to be in history books years from now? We are making history.
Oh,
That's
this
me.
for sure. This
Okay.
pandemic is like no other.
Okay. Any other questions? Okay.
Thank you. That was very helpful.
Yeah, Shauna,
I
thank
hope
you
so.
so
And
much
thank you for your good questions. I really appreciate it because, questions help us all learn.
Thank you,
It's
Shauna. Much
really
appreciated.
helpful, yes, to have your knowledge and be able to sit and ask this number of questions that we don't often get the opportunity, right? It's just one or two with your doctor, so it's so nice for you to take the time and really explain this to us. And thank you very much.
Oh, I really enjoyed it. And if there's any other time you think that, an NP would be of help for any of your advisory meetings, feel free. I'd be more than happy to help when I can. And if it's outside of my scope, I will direct you to someone who can help you.
Okay. That's great. I think we might be taking you up on that at some point. So that's really good to know. So thank you, Shauna.
Thank you guys so much. Have a wonderful day. Stay safe.
Thanks,
Great.
Shauna. You too.
Okay, thank you.
Bye.
Okay. All right. So what a great resource, everyone, for us to be able to ask those questions, right? So I know we're at 3:45, so I do have some things I do want to get through with the group. So I just wanted to update, kind of tying into what Shauna was talking about with where we are right now with our PPE. So what we've had the staff use as far as personal protective equipment has evolved over time. Just on a side note, I got some recent feedback from a member of the consumer advisory group, and I'm going to take it seriously. And what she said was, when we made our last change where we eliminated the staff having to wear gowns for routine personal care, the consumers weren't made aware of it. So we advised the staff, but not the consumers. And then the consumers left wondering, are you doing something incorrect? Where is the proper equipment? So, that to me is really the goal of the advisory group as well, right? It's, kind of pointing out from the consumer view, like, hey, wait a second, you missed this step. And so we can learn to do better. So the PPE that our staff use is beyond what is recommended by public health. Pardon me? Was that a cat? Sorry? So for routine, so our staff, we're requiring that they double mask. So if they're going into your home and they're just doing a meal prep or they're doing a check, they're coming in and whatever they're doing, they're able to be at least 6 feet apart from you.
Right.
You're going to see them with a loop mask and a cloth mask over top. Okay, so we may relax that in the future. Like that might be the next thing we look at, but right now we're keeping that. Especially in relation to the variants and, just kind of not knowing where that's at. For routine personal care, the staff are no longer required to use the gowns. So they will, for that, they're going to have an N95 or a KN95, basically the same, mostly the same thing, I guess I would say. You can expect them to have goggles, gloves. You absolutely should expect them to be coming in and sanitizing their hands, washing their hands right on entry. And I think it's important for consumers, as much as you're able, be aware of that. And it's your right to say to them, you know, hey, you missed a step, or hey, where's your goggles? Because it protects the staff, but it certainly protects the consumers. So we do continue to ask the consumers to wear loop masks while during any booking while the staff are there. And if they can't wear the loop mask, we can provide the shield. So just an update on that, a quick update. I think I have a comment here from Nola. She has staff with different interpretations. She has staff using full PPE while others just have masks. So, okay, that's why I think it's important. You're right, Nola, to make sure that consumers know that this is what we expect, and we don't want staff to interpret it on their own. So we can take a look at that after, Nola, and I think that's why this conversation is important, so everyone knows what to anticipate.
Yeah, because I was just gonna say the same thing, because there's been a couple of staff that have on my end that I've seen. Don't get me wrong, I've seen staff that have used the double mask thing. I've seen people that use the N95 still, which is good. And then I've also just seen people that are just using the surgical ones that they were using at the beginning of this. And just that, they were just wearing just that. Like I just saw one today that was using just that, and that's it.
Okay. Well, it's good to know. We need to reinforce that with staff. And I realize it might be getting a little bit warm and some of the stuff is warm, but we're not doing it to punish. We're really just doing it to protect. And, you know, we've come a long way from the beginning of the pandemic, where there really wasn't a lot of information about what can you do to protect yourselves or protect your consumers. So certainly I can reinforce that. So that's good to know, group. Thank you. I did want to give an update on AlayaCare. So last summer, we introduced a scheduling software program called AlayaCare that we use to schedule, replace shifts. I've got notes here that I'm looking at. Store our electronic consumer files are in AlayaCare. So if I need to look up someone's phone number, or I want to look at an OT report from last year, I can go to AlayaCare, submitting reports, and soon it'll even be doing our payroll and mileage, as well as service agreements, service plans. Everything is going to be in, not everything, but many things are going to be electronically available through AlayaCare. With that, the staff have received phones that on that phone, they're able to see what their schedule is, where they're expected to be, at what time. We can attach notes to that. So from here, if I wanted to, I could go into Sarah's schedule and make a note for whoever's going at 4 that an N95 mask is required. And then when they go, Sarah, to check in, they can see right there, oh, somebody's paying attention. Well, I don't know if they'll think that, but so you can appreciate there's that function, right? So let's say someone gets out of hospital, or a family member calls and says, you know what, my mom seems off today. You know, can you keep an eye on this? We can let the staff know that, you know what, can you keep an eye on this? And maybe they're getting that information back, and we can you know, help to pinpoint maybe a UTI, or, you know, something, or avoid a fall. So it's very useful in that everything is electronic. It's at your hands. It's easy to use. We've had some bumps with that. One thing I do want to clarify, and I think in hindsight, I think our name of the scheduling department is maybe a misnomer. So we have a department, we have a group of staff that we've hired specifically to work as schedulers, which really is data entry. But your program manager still completes the schedule. So your program manager still builds the schedule and builds the booking sheets, right? So assigns who to who. The schedule, they then give that information to the scheduling department, and their job is the data entry of getting it into the software program so that it's available for, and that the staff are seeing what they need to do and where they need to go. So there hasn't been a change in how we schedule. There's been a change, I think, in how we process it and how we read the schedule. So our leads are still important, right? So we still have leads, lead attendants, and we still rely on them to help with the smooth running of the program, right? They're still your contact person. So the scheduler, the scheduling department, that's not your contact person. It's still your lead, right? The lead is able to as well pull up. So there's different levels of permission. So when I talk about electronic files, I don't mean in any way to suggest that a lead can pull up and see your OT report from last year. They can't. But they can see the schedule in their neighborhood of care and who's where and what's happening. So they remain the contact person. So they're still, they're not doing as much perhaps of the filling shifts and making those phone calls.
Tracy,
Yes.
you said the lead does know where everybody's supposed to be.
They can look on, but they have to look at it in a different way, Penny.
But they can.
But they can, yeah.
Oh, son of a, sorry. Okay.
Well, I think there's a learning curve with it, right?
Yeah.
So what we're used to as a lead, I'm used to a paper, I'm used to a paper schedule that I can look at and see here. They still can look at the schedule, but now it's pulled up on a screen on a computer in a live care. And it's just, we have to get used to it. And we're pushing our leads to get used to it as well. So it's a different way. I've had to learn.
So when they tell me they don't have access to that, I should tell her you do have access.
Yes.
Thank you. Okay.
Yeah, you absolutely. You can say, Tracy said that you do have access. Yeah, they do.
They're going to start not liking you very much, Tracy.
That's okay. I don't mind. And yeah, they do have access. We've done training. So Remy is our director who has spearheaded Alaya Care. And in fact, she's gone to each site and sat down with those leads and done, walked them through the steps, how they need, because we rely on that. That's part of the smooth running, because they're the ones that would see, let's say if the schedulers replaced a shift and something happened or something was missed, they don't know Trinity, so they wouldn't catch it, but those leads will, right? They know,
right, yeah.
It should be here. No, what's going on? That person doesn't go, they're the ones, and we still rely on them for that. So, sorry, go ahead. Go ahead, Sarah.
Okay, when the consumer portals open up, you know how on the staff phones, their bookings can change, depending on if quick changes need to be made. They change in real time, right?
They can, yeah.
What I'm worried about is, because I'm not going to the grocery store or anything by myself, for myself yet, or whatever. But when things get safer and I start doing that, and I have access to a live care, I'm just worried that okay, in the morning I'll look at my schedule and it'll say one thing, but then a change will have to be made, and then I'm not going to be aware of it because I'm going to be at the grocery store because I don't have a cell phone, Tracy.
Okay.
And so I'm just worried that a quick change will have to be made, and then I won't be aware of it, and then I'll miss my booking because instead of at 1 o'clock, they have to come at 12 because of an unforeseen situation, and I'm not made aware of it because I don't have a cell phone. I only have a desktop and a tablet.
Yeah. Okay. So changes shouldn't. Now, with the exception of the last year with COVID has thrown a bit of a wrench into things with our staffing levels, as you know. With the exception of that, there should be no more changes happening now, Sarah, than there were, it should be no different than what would have happened a year ago or a year and a half ago, where you would go to the store. Like those changes should be infrequent. And that's where we rely on the leads, because the leads are the ones that are going to know you, right? So maybe they're there at lunch and know, oh yes, Sarah was going out for, and so that's where the lead piece is to keep an eye on that schedule as well, and where people need to be. So it is a work in progress. It's we're getting people to do things in a different way. We had staff who didn't even have a cell phone, never had a cell phone, and now they're getting their schedule on the cell phone, and it's going to speak to payroll, and they're clicking in and out. So I appreciate what you're saying, Sarah, and I think that I don't think that should become an issue any more than it would have been a year before, pre-Alaya Care, if you weren't home for your booking.
Okay, that's good to know. I'll have to step out early because my staff is here now, so
Sure.
I'll have to say goodbye, so I'm gonna say goodbye now.
Okay, thanks, Sarah.
Okay, bye-bye.
So there is a consumer portal with Alaya Care that we've been talking about. We're trying to work out the kinks. So the consumer advisory group, I've got a group of 4 people who are chomping at the bit in order to get into Alaya Care. So we've run into a bit of challenge, I guess, around setting up the permissions, right? So we have to, you can appreciate, we have to make sure when we set up the permissions that it's your schedule and what information are you accessing. And so, for example, you don't get to see the birth date of your attendant and her home address. So these are some of the things that we're just trying to sort out, but trust me, it's coming soon. I did want to share as well about the new building. So Penny had spoke to it earlier. We are moving. In fact, this building has been sold. So we really have to move. We are going to be moving to 1100 University Avenue. And hopefully June. So the people that, the contractors that are doing the building have said June. And I've been driving by and it's coming together. And as I said, this building has been sold and there's plans for this building. So things are going to have to start moving along. The new building, the nice thing there, it's fully accessible. So there's, and we're going to have our day programs there. We're going to have PI and Chrysalis from working from there, not working from there, but attending there. And there'll be full access to the building. So there'll be some programming upstairs, some programming downstairs. So it's not going to be as kind of segregated or choppy as it is here. So very excited about that. Janine has, Nola's got to go too. Thank you, Nola. Janine has a question about the role of the Consumer Advisory Group. Penny? Penny?
Yeah, hi.
Do you need to go too?
Yeah, but she just walked in.
Okay, all right. I'm going to speak to the Consumer Advisory Group.
Okay, sorry.
That's okay.
Hey, thanks everybody.
Okay, thanks. We ran over schedule. So the Consumer Advisory Group is a group of consumer volunteers who we meet once a month, and they provide us with, so they give advice on the direction of also. They give advice specifically around service. So for example, some of the advice I was getting earlier on, things that are happening, they've been able to go through the new, they've had the blueprints from the new building. They've given some suggestions early on that have been incorporated, things that, maybe when you live with a disability, you see things differently, or you have ideas beyond what is mandated. And they'll be going through and giving some more advice on that. So after I meet with the Consumer Advisory Group, and then there's minutes, and then I take from that suggestions and the key points from that, and then that becomes part of my board of directors report. So I have to put together a report on service every month that goes to the board for their review. So the information that I get from the Consumer Advisory Group goes through senior management and goes to the board of directors. So with the idea being that it's advising. So it's advising us on issues, suggestions, ideas, problems, kind of having an ear to what's going on, things we wouldn't know, like that different staff are interpreting the PPE. So things of that nature.
Okay, thanks, Tracy. But I heard you mentioning that they are asking for access to the scheduling. Is that fair as a consumer?
Well, what they're looking for, Janine, is it's access to their own schedule through AlayaCare. So they would only be able to see their own schedule. So they would be able, you're right, we wouldn't want them to see, and that's part of what our delay is, of making sure that the permissions are set, that they don't see any other consumer name, nothing except their own. So what they want, so for example, Sarah, who's off now, what she wants to do is be able to go into AlayaCare, open up her own portal, her own piece of that, and look at her schedule and who's going to her. Because you're right, the privacy is, yeah, that's kind of been a bit of our holdup actually of rolling out that other piece of it, is ensuring that the confidentiality of information is maintained.
Another question on scheduling, please.
Sure.
You mentioned also that there are some people who are scheduling staff and besides the lead. And I just wonder if those people understand the needs of the client.
Well, so it should be that, so what would happen? So it would be the program manager that is building the schedule, and that program manager should absolutely know the needs, the special instructions of that consumer. Where the change could come is if, because of a shift replacement, if someone is not available to go in, and then they're looking at setting up for that shift replacement. But AlayaCare does allow us, we can make notes right on, on the consumer. So, on Tracy's file, if it's opened up, it could say, for example, that I have I'm insulin dependent, so I'm type 1 diabetes. So whoever's coming in has to be someone that's trained specifically with me for this task. So we can add those notes. So to try to keep it as consistent as possible. And if we can't, you should be getting a phone call where, like, if it was, so is it that someone that you wouldn't know, Janine, has been sent out? Like a new person, or?
No, we'll always have like sudden changes to the schedule, and
Yeah.
new people are introduced, and they who don't know my brother, who don't know what his needs are. And recently we were asked to, if we want to accept more people to be trained. It's difficult on my mother to deal with new people all the time and tell them what they need to do and how they need to handle my brother and all that, because they get one session of training and the rest is up to my mother to deal with. So I hope in the future this gets improved, and if the scheduler understands the needs of the client, then they can arrange for the appropriate staff that actually work and a good match with this person, with the person with disability, especially with brain injury. It's very difficult to have a good match.
I appreciate what you're saying, Janine, and like I would agree with that. That it's important. Training is important, and if you can't send someone in blind, that's not going to be successful. We are not limited to one session of orientation or training. So we would set up as much training as we wouldn't even put a limit on it. I guess beyond within being reasonable. But our goal would be for people to be, we want them to be trained properly and to be competent and confident. So we would not limit the number of training sessions. We wouldn't want that to fall on your mom. It's been difficult. We're down staff from where we were last year. We've got still a number of people on a leave of absence, and that does affect our ability, our numbers So perhaps getting a bigger, I don't know what the group is for your brother, the group size, but I mean, it may make sense to have a couple of more, if that's happening frequently, then to me that says getting a couple of backup people trained, but trained well, maybe a good plan to be proactive ahead of that, where your mom may be getting the call and there's only someone new or who's only been there once.
There is also a challenge that if they are trained today and then there's on the schedule next month, they will be forgetting everything they've trained on.
Yeah, yeah. I know. I guess that's the catch-22, right? So you want it consistent, right? So especially if we're working with someone who, there's specific training that's involved, we want a consistent group. However, we need to have enough people that there's backup. Because if we don't, if we keep it just with, 2 or 3 people, we're bound to run into where there's no one to replace. So I guess that's the challenge. I mean, so increasing, and I would think that are you hoping to see just a smaller group of people that are attending there, Janine? Is that?
The regulars that are a good match, yes.
Yeah, the regulars that are a good match. So yeah, so I mean, I think it's a bit of a catch-22 that we need to. You're right. We need to have enough people trained that we've got backups that are ready to go and know the service, but we also have to use them on the schedule. We can't just use them only for backup, because if it's in 4 or 6 weeks, then they're not going to be as adept with that information that they need to help. So I can appreciate what you're saying. Did you want me to work with Kelly on that?
So far, we've been good. We have 6 people who have knowledge and trained well, and they worked enough with Sal. And we have 4 people who are steady, and I hope that doesn't change.
Yeah, yeah. That group's been pretty. There hasn't been a lot of turnover, so let's hope that continues to be the case.
And they love to come to our house and work with Mom and Sal, so
yeah,
we appreciate that.
yeah, I know.
Thank you so much. I appreciate everything you're doing for us. It's great.
Well, thank you. And I think we're almost losing everyone. We've got one
Yeah.
more other call. We went way over. I didn't know what to expect, but it's good. But the only other thing that I wanted to speak as well, that our day programs, for anyone who had was participating in the day programs, that those have been on hold for traditional attendance. Those staff have been redeployed. They're working in our neighborhoods, and we are looking forward to resuming at our new location. So that's all that I had as far as today. But Janae, do you think this is helpful?
Yeah, very much. Thank you so much. I really appreciate being invited to this.
Yeah, no, it's great. And I'm gonna work with the advisory group, and we're gonna make it, more. It's an important piece, I think, of getting information and sharing information. And it's good.
Communication is definitely important. Yes.
Yes, yeah, we're going to make it a more regular venue, and I think it will build with some momentum, and we'll get more people that are interested in. Yeah, so I thank you very much, and have a good day.
You too, honey. Thank you so much.
Okay, bye.
Bye-bye.
Goodbye, call-in user. I'm gonna end the meeting now.